Welcome to our Why Eat Plants series, where we're going to present a chronic medical condition, discuss that, and how a plant-based diet can either prevent it or improve the symptoms you have right now. Hi, my name is Dr. Vanessa Greer, and I am a nurse practitioner with over 35 years of internal medicine and preventive medicine experience. This is the second of our six-part series we will present on discussing how a plant-based diet can enrich your life and support healthy living. So I hope you watched the first one. This series is not meant to make you a vegetarian. It is meant about finding the very best diet for you to reach your personal health goals. I'm going to talk about Harvard Medical School had 5 recommendations to reduce what we call low-grade inflammation in the body. This inflammation contributes to chronic conditions. They recommend that you stop all fats that are solid at room temperature, such as lard and butter and shortening. They recommend the use of raw nuts in meal preparation. They also talk about not using salt. Don't use any salt until you've tasted your food. They even talked about your lunch. Taking your lunch will really help your health overall, and focusing on 5 to 7 fruits and vegetables a day. You will find the same meal planning will reduce the risk of many top chronic conditions in the United States. And today, we will discuss maintaining a healthy weight, and we will do a food demonstration, which will demonstrate how healthy lifestyle can work. We're advocating the whole plate diet that is created by Ardmore Institute of Health, and this model of eating is supported by Loma Linda University School of Public Health. We're going to build a plate with fruits and vegetables and plant proteins and nutritional foods on one plate. So watch for the next 6 parts of the series. So I worked in the emergency department for 17 years, so I saw a lot. And I saw a lot of people come in with conditions that could have been preventable. And I was working in the emergency department, and you'd think that that's the last place that for preventive care should be happening. You know, who has time when you're saving someone's life? But to me, if I have a couple minutes, I could save somebody's life by giving them a little information. So in my work environment, I will take 2 minutes, if I can, to just give preventive tips to patients. The patient I was seeing this one day had been triaged with abdominal pain. His blood sugar was super high. It was like 500. He was very thirsty. He had been urinating a lot, and he had what's called hyperglycemia. A lot of this had resulted over the last 3 months. So I ordered some lab, ordered some x-rays, because this tummy of his was really bothering him. So when everything came back and I examined him, I found out that he had diverticulitis and he had newly found diabetes. So he had 2 diagnoses. We had a lengthy discussion about how this happened. And he told me that he'd had a recent loss of his father. He'd moved in with his mom. She was cooking lots of food for him. He gained a lot of weight. This became significant weight because he wasn't working. He was just staying home and helping her. He was inactive. And he shared with me he was using cocaine. So I actually ignored that because at this point, I'm not putting him through drug treatment, right? I want to look at what's the primary problem that could kill him right now, and that's going to be what he came to see us for. I told him I wanted to give him a chance to get his health back, and he was in agreement. He wanted to make healthy food choices that would change his life. So I shared the USDA's vegetarian food pyramid with him, and that lists fiber foods, and he was told, I told him, eat off of this list and take your diabetic medication. I ordered that for him, and I ordered antibiotics for his stomach condition, and he went on his way. So fast forward 5 years. It was about, no, actually it was 2 years, actually. And I saw him again in the emergency department, and this time I didn't even recognize him. He had lost like a lot of weight. He looked so good. He told me he left the emergency department that year with it. He saw me, and he determined to get his life back. He took the antibiotics for his stomach to clear up the infection, and then he started the diabetic medicine, which brought his blood sugar down, and he started feeling better. Once he started feeling better, he bought a bike with a big seat because he was heavy. He was heavy at the time. and he started riding the bike. And his family was like laughing at him because they couldn't believe someone that never exercised was exercising now. At first, he said he could hardly ride the bike a block. Then every day he added one block after another until he was riding 5 miles a day. He lost weight. His blood sugar came down to normal, and his medications were greatly reduced. He then decided to get help for his drug use, and he went through a recovery program. So he made full circle. He felt well enough and was thinking well enough, so now he could engage in a drug treatment program so he could get better. The reason he was back in the emergency department that day was because his blood sugar had bumped up again, and this was because he had weight gain. When he left, he had said, "I know now what to do. I just need to do it and stick to it for a lifetime." He was right. Losing weight and maintaining a healthy weight requires a lifestyle change for life. The Center for Disease Control reports that the prevalence of obesity has increased by 41% from 2017 to 2020, with severe obesity increasing by 4.7 to 9.2%. Conversely, obesity is related to conditions such as heart disease, stroke, type 2 diabetes, and colon cancer now. They're finding a link with obesity. These are all preventable causes of premature death and disability. More striking is the estimated medical costs associated with this. The United States spends nearly $173 billion just in 2019 on medical costs. That means that those that have obesity are costing $1,861 more than those without obesity in the healthcare system. Researchers have found that obesity leads to inflammation in the body, and this inflammation promotes early onset cancers. Those who eat a plant-based diet, though, have lower body mass index and lower inflammation, which affects weight loss. You can calculate your body mass index by going to the internet and type in BMI calculator and enter your height and weight, and it'll give you your number. In order to keep your cardiac and diabetes risks down, you will want to have a BMI less than 30. Based on the available evidence, plant-based diets should be considered a viable option for those in need of weight loss for chronic disease prevention, such as diabetes, heart disease, kidney disease, and liver disease. And there's even some research coming out on lung disease and vitamin A intake, how important that is to protect your lungs. So how do we eat a plant-based diet and lose weight? And can we get enough protein? It's very interesting how the same plant-based diet that prevents obesity also prevents diabetes and kidney disease and liver disease. So we don't need to worry too much about proteins because the essential proteins that we need to build our muscle up in the human body, tissues, and as a source of energy is all in plants. Proteins are made up of chains of amino acids which break down during digestion and are absorbed in the bloodstream. Protein can then be used to grow the muscles, repair the body tissues, and create antibodies to help fight infections, and also produce enzymes to break down foods in our digestive system. There are approximately 20 amino acids, 9 of which are essential because the body receives them from the food we eat. So that means we're deficient of amino acids to protect us when we don't eat plant-based foods. Although animal proteins are considered more complete because they contain all the essential amino acids, vegetarians and total vegetarians, vegans, are readily able to get enough essential amino acids by eating a variety of plant-based proteins. Plant sources of dietary protein are easily able to supply the nutritional needs of adults and growing children, those who are physically active, and those as they age, and the elderly. The key is to eat a variety of plant proteins each day. They do not have to be eaten together, though we will find, without even trying, you do end up eating them together. So let's talk about some plant-based proteins. They include beans, peas, lentils, or legumes, processed soy grain products, meat alternatives, nuts, seeds, and dairy, eggs and milk. A healthful diet should limit high-fat and salty protein dishes, such as high-seasoned entrees, meat alternatives, and deep-fried foods. And some vegetarian restaurants tend to serve this type of plant-prepared food. It's too much salt, too much fat, and too much sugar, too. Teenage boys between the age of 14 and 18 require 6.5 ounces of protein per day, and girls in the same age group require 5 ounces equivalents per day. An ounce equivalent of protein may be obtained in a quarter cup of cooked beans and a teaspoon of peanut butter, a half ounce of nuts or seeds, or 1 egg. So you can see this is doable. The adult male requires 56 grams and the adult female 46 grams of protein. In reality, the whole world lives on 28 grams of protein per day because a lot of animal protein sources are not available. A complete protein is created when the proteins are combined in a number of ways. It can be beans and grains together, beans and seeds together, beans and nuts together. Plant-based complete proteins are tofu, edamame, tempeh, and soy milk. Grains have substantial protein, fiber, iron, B12, calcium, magnesium, and amino acids in them. In addition, to regulate your blood sugar, we need these grains. We need them also to reduce cholesterol and improve acid-base balance in our stomach so we don't get gastritis and reflux in our stomach. So let's just briefly look at some of the plant proteins that we're talking about. So grain and seed proteins can be anywhere from quinoa, which is a grain that has 8 grams of protein. Hemp seeds, just 2 to 3 tablespoons, have 11 grams of protein. Chia seeds have 4 grams of protein, but it also includes omega-3s, which protect our heart. That's just 2 to 3 tablespoons. Walnuts have 18 grams of protein and amino acids and omega-3s, again, to protect our heart. And then almonds, and then there's a grain called amaranth that's used in a lot of other countries. It's very high. 1 cup has 28 grams of protein. A cup of beans has a good productivity of protein and fiber together. So when we look at fiber guidelines, we want to put those together with our proteins. So women require 25 to 28 grams, somewhere around there, and men 34 grams. And as you get older, you don't need as many grams of fiber as you do when you're younger. So when you look at plant proteins and their fiber content, it's pretty eye-opening. Like just chickpea alone has fiber content of 15 grams, and the protein is 17.9 grams. So that has a complete fiber, protein, and amino acids. And then there's peas. You know, just 1 cup of peas gives you 8.58 grams of protein and then a whole bunch of fiber too, 8.8. Then there's kidney beans and black beans and soybeans and pinto beans and navy beans. There's all these different kinds of beans, but peanuts also has fiber in it, and it's very high in protein, 18.9 grams. But the problem with peanuts or nuts is they're very high in calories. So 414 calories for a cup of peanuts. So you want to be careful if you're trying to lose weight not to consume lots of nuts or to just limit your nut butters to a tablespoon in a recipe. In August of 2016, the issue of Journal of American Medical Association and Internal Medicine reported that a high intake of proteins from animal sources, especially processed and unprocessed red meats, was associated with increased death rate. Conversely, though, they said the increased intake of protein from plant sources was actually associated with a lower death rate. The data was drawn from 2 large studies representing 3.5 million persons. That's a lot of people. And the conclusion of the researchers is people should eat more plant proteins than animal proteins. And if animal proteins are consumed, red meat should never be consumed and should be avoided. Additionally, dairy should be used very sparingly. And I was reading from a book on diets and health by Ellen White, and she actually makes a statement that cheese should never end up in the gastric system. And I had never seen that before. So it really opened my eyes of what are we putting in our stomach and how is it affecting our stomach. So today our recipe demonstration is going to be a healthy oat patty. And you're going to not want to miss this because this is going to be a great option for a sandwich for you, either for lunch or for dinner. So we're going to talk about an oat patty and how that can replace a sandwich filling. How are you going to stop using sandwich meat that's refined? So we're going to show you a few ways that you can make something to put in a sandwich. So we're going to start with this healthy oat burger. We're going to put 4 cups of rolled oats into the bowl. Then we're going to put a half a cup of ground processed. You can do this in the food processor, or if you have a nut coffee grinder, that works fine too. Half a cup of sunflower seeds ground up. Then we're going to put 3 tablespoons of flaxseed. Remember we talked about flaxseed? It has omega-3s in it. And then we're going to put a 1/4 cup of nutritional yeast, which gives you kind of a cheesy flavor. So we're going to put that in there. Then we're going to add basil, oregano, and then some finely chopped onion. And we're going to add some more omega-3s from our walnuts. Okay, while we're doing this, then I've been boiling 4 cups of water, and I'm going to add to that, I'm going to add the soy sauce to the water. And you want it to be nice and hot. And then we're going to go ahead and add that to our mixture here. Because you're going to create a kind of like a doughy substance here that's going to make your patty. And then this is going to go into an oven. You're going to put it on a cookie sheet with a silicone pad or parchment paper and bake them at about 350 degrees for about 20 minutes till they get golden brown. And let me show you quick how you're going to actually make the patty, because you're like, how am I supposed to shape that patty? I'm used to making hamburgers, using hamburger. That's easy to make a patty, right? You're going to take a lid. This is like the lid to a jar. Put a little bit of saran wrap inside, or plastic wrap. And then you're going to put some of you're going to press that in there. And then when you remove it, it's a little patty. And then you're going to put that on the cookie sheet. And then you're just going to line them up and bake them that way. So for this one, what you're going to do is you're going to have a block of firm tofu, and I've sliced this up. I've sliced these into slices. They've all been sliced up, okay? And we're going to put 3 tablespoons of balsamic vinegar into a bowl. Then we're going to put 2 tablespoons of maple syrup and some soy sauce. And then we're going to put some maple syrup into that soy sauce mixture. Some olive oil. This is actually a tablespoon of avocado oil. It's a healthy oil. And then we're going to add our nutritional yeast, about a tablespoon. Start mixing that up. Some garlic powder and dried oregano with coriander. I've mixed those together for our demonstration today. And what you're going to do is you're actually just going to mix this up. It's a marinade. Like pretend if you were eating steaks and you used to marinate your steak or chicken, you just pour it over. And you coat them really well. Coat each of these layers really well. You're going to put it on a cookie sheet, each one. Just coat it, just coat them. Then you're going to put it on a cookie sheet on parchment paper or a silicone mat for 8 minutes in an oven at 400 degrees. Then you're going to flip them and put more of the marinade on the other side. And so what you end up with is this beautiful little, looks like little steaklets actually, and it's braised tofu and they're very yummy. So let's see, let's take these and make a sandwich out of them, okay? So what we're going to do is, I'm an advocate for a fast and easy sandwich that I can take for lunch. So I'm going to take a whole wheat tortilla here, and I'm going to use tofu mayonnaise. The tofu mayonnaise recipe was on the #1 series, #1. And you're just going to spread a little bit of tofu mayonnaise on one of the tortillas, just like this. And you're going to use some lettuce and some tomato. And for each section, pretend that there's 4 parts to this section. We will find, and you're going to take one of your burgers and put it here. Fold it over. Then you can put a little bit more mayonnaise if you like that, with your tomatoes here. You're going to fold this over. And then if you want to put a little piece of, you can put a little piece of avocado in that. It's going to make a nice sandwich. And then put your lettuce, the last part here, and fold this over again. And then you have a sandwich, right, just like this. And nothing falls out. It's just a nice little sandwich. So that's one of the sandwiches. Then the other one, you can use the tofu mayonnaise if that's available. And you're going to take a piece of your tofu, braised tofu, and you're going to put it on one side. And you can put your lettuce, try the lettuce this time here. And then fold that over. And then you can put, I've got the tofu mayonnaise right here now. So we'll just put a little bit of that, put that on there. This is the ranch style that we made earlier in the first part of the series. Put a little tomato there, and then we'll put a little avocado. We'll fold that over, put another piece of lettuce here, and then there you go. You have another one of your sandwiches ready to go. That's a quick and easy way to have lunch. So I hope you've enjoyed these 2 recipes, and I hope you enjoy making lunch for yourself every day this week.